Many Triad area kids are back in school as of today. Of course, first day of school for Guilford and Alamance counties. How can parents and caregivers help keep that positive motivation going? And what should we know to help our kids have a healthy school year? Well, pediatrician Dr. Nicole Chandler with Cone Health at Tim and Carolynn Rice Center for Child and Adolescent Health, and psychologist Dr. Jenna Mendelson with Cone Health LeBauer Behavioral Medicine. They're both here today to talk about all of this, and they're taking your questions. So parents at home, grandparents at home, maybe you have questions that we might not get to. We want you to be able to ask them to the expert. You can text it to 336-379-5775. So Dr. Chandler, let's start with sleep. Okay. We know as adults, when we don't get sleep, we get really cranky. So what happens with our kids? Because we just think the kids are just going to bounce back.
Right. Sleep is just as important, if not more important, for kids. Kids are growing. That's one thing that's really important to think about. We're not growing anymore, so that's one thing we don't need sleep for. On top of that, they're going to school and we're challenging them to learn every single day. Sleep is very, very important. One of the things that can really help kids get good sleep is having a consistent routine every single night with similar bedtime, similar wake up time, even on the weekends if you're able to do that. Turning those electronics off at least 1 hour prior to going to bed to help the mind start to calm down. And as part of the routine, kind of doing the same things at night. So getting ready for bed, putting on your jammies, brushing your teeth, and then story time or book time, it can kind of change through the ages, is a great time not only for family bonding, but also for trying to calm down the nervous system and get ready for bed.
Hard to get those teenagers off of those screens that last hour for sure.
Yes, it's absolutely the number one thing that causes a sleep problem in kids.
Are those screens. Okay. We'll be talking more about that for sure. Dr. Mendelson, let's talk about the changes in routine. I mean, today was the first day back for Guilford County Schools, so I mean, everybody changed everything today.
Yes.
And that's a lot of nerves and a lot of anxiety.
Absolutely. Big day for a lot of kids, major changes. There's a lot that can be so overwhelming about the first day of school. Just so much new input, especially if your child is starting at a new school. They're learning their way around a new building. They're meeting a lot of new kids, new teachers. It's just a lot.
What happens when it's not new back to school jitters anymore, that it moves on to something else? How do we know that it's no longer that, it's now something else?
Good question, important question, because unfortunately rates of anxiety and depression are at an all-time high among kids and teens. So it's really important to know what those signs are. And they include changes in sleep or eating habits, pronounced changes in mood. So if you notice your child seeming more down or tearful or even aggressive, they may be going through something. If your child is isolating, they suddenly don't want to hang out with friends or family, they may be having a struggle. So one thing that you're going to hear me say maybe more than once during this segment is not to wait until it's a crisis before seeking help. So to the parents out there, if you're in a situation where you're not even sure if there is a problem, go ahead and get help. Reach out to a therapist. We have great therapists at LeBauer Behavioral Medicine, and the therapist can work with you and your child to figure out what's going on.
Right, it doesn't have to be a thing like something's wrong. It just needs to be, hey, I want to make sure you have a healthy school year. I want to make sure you talk to somebody about what your concerns are.
Exactly.
Besides mom and dad who just say, oh, don't worry about it.
Exactly.
Right?
Yes.
Okay. All right, so sometimes that stress and anxiety actually makes us feel ill. We get the stomach aches, we get the headaches, that kind of stuff. How do you tell if your child's symptoms is really like they don't feel good or it's just stress related?
Right. Well, and to follow up on not waiting till the last minute, your pediatrician is your kind of first go-to for those feelings, as we can help you connect to a therapist, a local therapist, as needed. But this is something that comes up all the time. So kids feel their anxiety often in their tummy and often feel it in their head. So tummy aches and headaches are a really common symptom of having anxiety or fears or worries. But as we all know, they can also be a sign of a viral illness. And so timing makes a big difference. So one of the first things I ask parents when they come to the clinic with such a complaint is, do you notice that they're complaining of these same symptoms on the weekend, or is this only happening on school days?
Gotcha.
That's a big one.
Sunday night before Monday morning when they don't want to go back to school.
When we're all feeling
Right.
the Sunday night scaries or feeling anxious about our week to come. Do they notice any associated symptoms? So if they're also having fever, vomiting, diarrhea, then yes, I think this is probably a viral illness. Another really common cause of abdominal pain in children is constipation. So are they feeling full, not wanting to eat? And then I would say go take a look at their poops and see what they look like. Are they a little bit hard? But if this is occurring, yes, Sunday night or in the mornings before I go to school, it seems a little bit better Friday night and Saturday, then maybe we're actually seeing some anxiety or some worries.
All right. The first day back to school or the first couple of weeks, it's always like a petri dish at everybody's house, right? It's like you get everything all over again. So how do we help strengthen our child's immune system so that it doesn't happen like this every time?
Great question. So some of just the old things that we all remember from mom and grandma talking to us is wash your hands. If your child is sick, stay home from school so that we're not spreading it to other kids. And of course, I can't say how important it is. And to me, I always say it's like buckling your seatbelt is getting your vaccines. So it's get in your car, you buckle your seatbelt. It's easy to do. It prevents terrible things from happening if you get into a car crash. That's your vaccines. Go to your pediatrician's office, make sure your child is up to date on all those vaccines, especially now because we are seeing more vaccine preventable diseases.
Let's start off, Dr. Mendelson, about that question of when your kid comes home, they've had a bad day, and they say, I've had a bad day, I don't want to talk about it, it's fine. So how do you get them to talk about it?
What I like to say is connection first, communication second. So look for opportunities to connect with your child. That first day of school can just be so overwhelming, especially a bad first day of school. Your child might just be exhausted and they really might not be emotionally in a place where they want to talk about it, and that's okay. So it can be helpful to think with your child, ideally in advance, about what would be relaxing for them. Maybe they just need to decompress in front of the TV for a little bit. Maybe you can sit with them and do a Lego together or do some drawing where the opportunity is there that as they decompress, if and when they feel ready to talk, they'll do that. But at the very least, they're getting to connect with you and they're feeling that support and that availability from you.
Instead of that like one-on-one of tell me everything right now.
Yeah.
Got it. Okay. All right. So Dr. Chandler, when it comes to breakfast and lunch, we want to make sure that we're sending stuff in the lunchbox, A, that would be eaten, we hope, and B, that's something that's good for them.
Yeah. So and nutrition is important, of course, when we go to school. Making sure we have breakfast before we leave is an important thing that we often forget, especially with teenagers. High protein foods that are easy to make and easy to take out the door, peanut butters if you're not allergic, yogurts, things that you can easily kind of carry if you don't have time in the morning. If you have time, the whole egg, sausage, and that would be great. Lunch, I would recommend as soon as your child's able, have them participate with you in packing that lunch. I'm a mom too, and that worked really well for my kids, where we would say, okay, I would, you give, depending on their age, you give them a certain limited number of options. What do we want to pack? And when they take ownership in that, they're actually more likely to eat what you pack.
That's true too. Okay. All right, Dr. Mendelson, no one wants to think that their kid's going to be bullied. But what happens if you notice that your child is being bullied? What should you do? How do you step in as the parent?
Yeah, it's such a challenging situation to be in, and it can be hard to notice those signs because unfortunately, many times when children are being bullied, they're hesitant to open up. They may be afraid of the bullies finding out, kids calling them a tattletale, repercussions from the bullies, or they may feel ashamed or embarrassed of the bullying. So a good first step is just to normalize the experience. Certainly if you as a parent have been bullied, it's a good time to open up, let them know, like, yes, this happened to me too. And again, it's a good time to reach out for support. Having someone that your child can talk to who's a neutral third party, where they know they have that confidentiality, no one's going to tell on them, can be really key in helping them respond to bullying with resilience.
What happens when you find out that you are the parent of the bully? I mean, that happens.
Yes, it certainly does. Equally tough situation, if not more so, because often, certainly if the parent has experienced bullying, that can trigger a lot of emotions. disappointment, anger, what have you, toward your own child, which is a tough situation to be in. But it's important to remember that bullying has significant negative outcomes for kids who are the targets of bullying and the bullies themselves. So if your child is engaging in bullying behavior, they are causing themselves harm and they need help. A good first step is to reach out to their educational team to try to learn more about the larger context of what is going on. Educators have a front row seat to some of the more nuanced social interactions where maybe they've noticed if your child is suddenly excluded from a friend group that they used to be in, or they're not participating how they used to. And then it's a key of having a difficult conversation with your child where you do your best to come from a place of empathy and compassion and trying to understand, validating whatever emotions they may disclose, while firmly and clearly communicating a boundary around the behavior itself.
Yeah, what the actions are.
Yeah.
All right. So let's talk about what should be top of mind for parents and caregivers when they're planning for a healthy entire school year.
Okay. Well, I want to kind of bounce off of what you said there. One of the most important things to me that I talk about at every single visit, if I can, is electronics and more importantly, social media. And so the longer you can push off social media, the better. We know that social media is associated with depression and anxiety in teenagers. Absolutely. And the one thing that's different from when we were children compared to kids now is before you'd go home and the bully is not with you anymore. That bully's at school. Now the bully can follow you anywhere you bring that phone.
Right.
So keeping the phone charged, not in the kids' room at night. I want you to charge it in the kitchen or in the parents' room. And seeing what they're looking at, holding off on social media, and just talking to them about it. The only other thing I did want to mention was Cone Pharmacy. They were very sweet and lovely to provide us with these little back-to-school bags, which puts a bunch of different items in the same bag at a much lower cost than if we bought them separately. So
all the things that you would need to get through the school year, like allergy stuff, Band-Aids.
Allergies, Band-Aids, ibuprofen, Tylenol, a thermometer. And so these are sweet little bags. They're available at all
Just
the Cone pharmacies, grab and go.
All right, we got one of the questions. We got 1 minute. Are there any emerging illnesses or outbreaks that parents should be aware of this year, and what can parents do to prevent them?
Yes, important question. We are seeing whooping cough, as a lot of people probably know watching the news. We are seeing measles, as a lot of people know. And I hope that we aren't going to see more vaccine preventable diseases. These vaccines were made for a reason, to prevent things that cause kids to die, kids to be paralyzed, kids to be in the ICU, and all it takes is the vaccines to prevent them. So I would just say again, please be sure your kid is protected.
Right, and not just your kid, but the people in your family who are going to be
Your
really close to
family,
your kid, especially the whooping cough and stuff like that, right?
Oh yeah, grandma, newborn baby, sibling.
Issues there. Okay, thank you both for joining us on this very first day of school, hoping to help with some of the jitters, hoping to make sure that you have a healthy school year.